All right. Well, thank you all for joining us in a conversation on the importance of early intervention in supporting the development of infants and toddlers. My name is Amy Mead. I am the director of the Center for Early Learning at Groundwork, Ohio. Welcome. A few housekeeping items for participation in today's webinar. The webinar is being recorded. There is closed caption available on your taskbar. All participants are muted, so please use the Q&A function for any questions. We have a full agenda, so just know that if we can't get to any of your questions today, we will follow up immediately following the webinar with the recording of the event and then any questions you may have asked in the chat. We bring you an impressive lineup today to discuss early intervention and its impacts on young children and their families in Ohio. I'll provide some additional remarks, and then we will hear from a panel of experts deeply committed to serving children and families through early intervention. Please follow Groundwork Ohio and our presenters today on social media and visit our website for more information. We would like to express a special thank you to our funders and partners, W.K. Kellogg Foundation, the Cleveland Foundation, and BI3. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004 that champions high quality early learning and healthy development strategies from the prenatal period to age 5 that lay a strong foundation for Ohio's kids, families, and communities. We work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. Recently, Groundwork Ohio launched 3 centers of excellence: the Center for Family Voice, the Center for Maternal Young Child Health, and the Center for Early Learning. This webinar is a product of the Center for Early Learning and the Center for Maternal and Young Child Health. While each center has unique priorities and concentrations, they also provide a collaborative, multidisciplinary, and comprehensive approach to transform policy, remove barriers, and ensure all children and families are ready to thrive. Access to quality early learning and early intervention is vital to supporting and maintaining a child's overall health and well-being and contributes to the long-term vitality of our state. Providing early intervention to children with developmental delays or disabilities can prevent later need for behavioral health-related intervention or reduce the intensity of interventions needed. This is an incredibly timely conversation today, as some important legislative opportunities are moving in our Ohio State House that would directly address some of the barriers to families' ability to access early intervention services. Just last week, Groundwork Ohio attended the first hearing for sponsored testimony on Ohio House Bill 7, called the Strong Foundations Act. And right now, some of our team is at the State House joining a press conference with maternal and infant health stakeholders ahead of providing proponent testimony in support of this legislation. House Bill 7 is a package of support for pregnant women, mothers, and babies to address maternal and infant mortality and improve health and developmental outcomes, including improvements to Ohio's early intervention eligibility. Specifically on early intervention, the bill would require that premature infants are eligible for EI program services without any other required conditions, which that is a current limitation in our state, as well as allocate $4 million under the Department of Disabilities to provide EI services to infants born before 38 weeks of gestational age. We're incredibly grateful for the leadership of Representative White and Representative Humphrey, the 2 leading bill sponsors of House Bill 7, who are champions for young children and families in Ohio. Ohio Early Intervention is the statewide system providing coordinated services for families of infants and toddlers with disabilities or developmental delays. Early intervention programs were established under the Individuals' Disabilities Education Act, and their programs are regulated federally by the Office of Special Education Programs and in Ohio by the Department of Developmental Disabilities. In November 2020, the Governor's Children's Initiative published the final recommendations of the Children's Service Transformation Advisory Council, including the recommendation to elevate prenatal to 3 prevention and early intervention efforts by identifying barriers and efficiencies to increase enrollment, improve service delivery, and better coordinate care. Ohio early intervention is grounded in research that demonstrates young children learn best in familiar settings and from familiar people. The services offered through early intervention equip the family and caregivers in supporting their infant and toddler. This is made possible through a service coordinator's and service provider's assistance through an individualized family service plan. Each early intervention system has a point of entry or local regional contact point designated to accept referrals from sources who suspect of developmental delay or disability in an infant or toddler. Referral sources can be parents, caregivers, healthcare providers, teachers, childcare workers, and social service personnel, among others. In Ohio, 25,733 children were served in early intervention in state fiscal year 22. In state fiscal year 2021, 99% of children with IFSPs received early intervention services in their homes or other natural environments. In state fiscal year 21, 29% of children were referred by their families and caregivers. And in 2021 as well, 95% of parents reported early intervention services helped effectively communicate their children's needs, and 93% reported developmental and learning help. Positive early learning experiences are essential prerequisites for later success in school, the workplace, and the community. Consistent evidence has emerged from rigorous studies of early intervention programs, particularly those focused on premature or low birth weight children. The evidence suggests that services can improve outcomes in cognitive development, language communication skills, behavior, and motor skills. Early intervention is a worthy investment and not just for kids. The earlier we provide resources to educate people, the more money we save in the long term. Investments in early childhood not only benefit the well-being of children and their families, but also pay long-term dividends to the state and our economy. The foundation for a healthy life starts early. Providing early intervention to children with developmental delays or disabilities can prevent later need for behavioral health-related intervention or reduce the intensity of interventions needed. Qualifying for early intervention is based on the infant or toddler's developmental needs. The services are free and available to all eligible families, regardless of income. Each state has some discretion in setting eligibility criteria for early intervention services, including how to define developmental delay. As a result, definitions of eligibility for these services can differ significantly from state to state. I would like to highlight that Ohio is one of just 9 states that report that they refer 100% of eligible children who have experienced maltreatment to Part C agencies. Despite extensive research on early intervention, many of Ohio's infants and toddlers don't have access to the early intervention services they may need. Ohio only serves 5.9% of its 0 to 3 population in early intervention over the course of the year, while 10.5% of babies were born preterm. This puts Ohio in the bottom half of states on an indicator of children served. Similarly, lead exposure can result in developmental delays, and data suggests that babies who have had lead exposure are not getting the early intervention services they may need. Ohio ranks second highest of all 50 states on the number of children with lead in their blood, and lead paint may be present in as many as 2/3 of Ohio's homes. Many of you have joined us today because of your interest in early intervention, and I encourage you to review the recently released fact sheet for some early intervention basics and the research on the impact of early intervention. We will drop it in the chat for you to look through. The bottom line is that our youngest children are our future workforce, parents, caregivers, and leaders. We can secure a strong future for Ohio by prioritizing the needs of our youngest Ohioans. While Ohio has made progress in fostering a landscape that supports young children and their families, there is still significant room for improvement. Without increased investment and support, some young children can face lifelong challenges to their physical and mental health. Now is the time for Ohio to invest in what works for infants, toddlers, and their families. It is my privilege to now welcome today's panelists. Melissa Worvey-Arnold, CEO, Ohio chapter of the American Academy of Pediatrics. Jenny Ramey, Statewood Coordinator, Early Intervention Business Services for the Ohio State School for the Blind. Erin Simmons, Parent and Co-Chair of the Ohio Early Intervention Advisory Council. And Terry Betts, Senior Manager, United Success by Six, United Way of Greater Cincinnati. Thank you all for joining us today. I'd love to start the discussion with Melissa. Melissa has over 23 years of experience in the association management, fiscal oversight, event planning, and development field. In her current role as CEO of the Ohio chapter of the American Academy of Pediatrics, she provides leadership to the chapter and its membership, as well as serves as the head of the Ohio AAP Foundation. Thank you for joining us today, Melissa.
Thank you.
So the first question I want to ask is, what role can pediatricians play in identifying developmental delays, referring families to Ohio to services, and helping facilitate family involvement in EI?
So I think the biggest thing that, I've been with the Academy for about 18 years now, and 2 years into my term, developmental screening was sort of all the rage. So it was convincing providers that what we consider developmental surveillance was just no longer cutting it. We weren't identifying kids early enough with surveillance. There was too much wait and see. And that was sort of the comfort zone about 15 to 18 years ago. And the state and pediatricians and family physicians and early intervention specialists all came together and said, how do we improve early diagnosis, early referrals, early treatment for these families? And really the state pushed on developmental screening and evidence-based developmental screening and how to get that out there. So there was lots of programs that were developed back then at the time. One of them that the Academy ran was called Concerned About Development. And it really talked about exactly what it says. So looking at, if you're concerned about your child's development, do something. But also it really pushed on providers. And when I say providers, I mean medical providers, so physicians, nurse practitioners, and those folks, to really do an evidence-based screen to make sure that we were capturing these kids early. Back then, I think when we started the work, it was about 1 in 32 kids had a developmental delay. And now I know the American Academy of Pediatrics says that number is about 1 in 6. Wow. And the reason, so people will say, well, is it 1 in 6 because of environmental factors? Well, sure, there's some of that. We do know you mentioned lead. So we do know things like that are a problem. But a lot of that is really just identifying this earlier and really getting these kids services and help. And before that, we really weren't doing that. We weren't doing it well, not just here in Ohio, but everywhere. And so now we're seeing our providers, it's just standard for them to do an ASQ screening with families at 9 months, 18, and then either 24 or 30 months, as well as an MCHAT, which is autism specific, at 18 and 24 months. And those things really start to identify things much earlier than they used to. I mean, we're seeing, 3 to 6 to a year earlier than 3 to 6 months to a year earlier than they used to be. And I think that's pretty critical and a big change. And so again, a lot of people say, why is that number growing? And some of it is growing just because we're doing a better job at identifying it. Our members will still say the biggest challenge for them still is not being able to get families in with services, not through early intervention. They certainly get those very quickly. But it then takes still a long time to go through the process to get, to lead to a diagnosis. And they just don't want to wait and see anymore. So many times, if, for example, autism is sort of the concern, you can get in with speech services in a few weeks in most areas. So starting some of that earlier. So I think that's critical to make sure that that's happening. And I think, having, resources for families and talking to them appropriately about it as well is pretty critical. I know we have a couple of different programs. We have a preventative health program that has a great resource. If you went to our website, which is ohioaap.org, under the resource room, there's a whole section for families. And one of them is around, it says developmental milestones. And there's a great sort of walkthrough of what you should sort of see for your child. And it's really, really some basic things, when are they walking? When are they talking? When are they crawling? But also, will they make eye contact? If you hold something out for them, will they be able to grasp it? And, that's, again, it really kind of goes back to developmental surveillance. That's what surveillance used to do before we had evidence-based screens, but parents can be doing some of this at home too. So when they see their pediatrician or their family physician, they can come in and say, I have concerns. So getting families comfortable with knowing they're allowed, they're allowed and they should speak up about what they're concerned about. And then how do we get them in with resources quickly? And I think, I hope most pediatricians are doing the right thing and connecting them with early intervention quickly. That's what we're being told they're doing. So I hope that's happening. If it's not, I would love to hear about it because we would be happy to push them more on that. And I know many of them feel pretty comfortable with the relationship they have in their own counties. And so they, especially some of the smaller counties, they really know some of the early intervention specialists. And I think that makes a big difference too, having that relationship and that two-way communication where the physician and the early intervention specialist can have a conversation about the child and the family and make sure we're getting these families the services that they need.
Thank you so much. Yeah, it really is a community of care. I know I have a daughter who was in speech. She just graduated. And it, is really helpful to just, troubleshoot with her pediatrician. And, when I did have any concerns, she was, able to provide some advice. Thank you so much, Melissa. I'd like to now introduce Jenny Ramis. Jenny Ramis is a teacher for children with visual impairments and certified orientation and mobility specialist at the Ohio State School for the Blind. She has a BS in special education from Ohio Dominican University and an MED in visual impairment from the Ohio State University. Jenny has over 25 years of teaching experience, which includes special needs preschool, middle school students with multiple disabilities and blindness, orientation and mobility training, and her current role in early intervention. Jenny is a member of the Governor's Early Childhood Advisory Council and also serves as an adjunct instructor for the OSU Vision programs. Jenny absolutely loves working with families and babies. She lives in Columbus with her husband and 3 children who range in age from 15 to 22. Thank you for being here, Jenny.
Thank you for having me. I really appreciate it.
So, the needs of families are individual and complex. Can you share how early intervention meets families where they are and what is meant by an individualized family service plan?
Sure. And I can't see my camera, but I'm hoping that I'm on.
Yes, you are on.
Perfect. So, really, as a special educator, we will often say to families when you've met one child with, plug in whatever disability, then you've met one child with that disability. And by saying that, it's really just acknowledging that even with the exact same diagnosis, children are going to be unique. They're going to have different needs. No matter what. And this is really the same with families. So in earlier intervention, that's really where we begin. I mean, we start with families doing just a questionnaire, talking with them about, what are their needs and what kinds of supports are most important to them. And it's going to look very different from one family to another, just like it is from one child to another. And it's really important to understand and recognize that parents themselves need to be in a state of homeostasis before they can fully support their child. I mean, this is why we are told to put on our oxygen masks on planes before we help our children. So with the IFSP or the Individualized Family Service Plan process, we're really helping families to identify their specific areas of difficulty or need and the types of supports that are going to help them, and then create this plan that helps them to meet those needs, identify who can be of assistance, so that they can then support not only themselves, but the growth and development of their child. So it's very family-centered, and that's really how it's meant to be, because when families are invested and we are there to help and coach them through it, then good things happen all around.
Mhm. Thank you. We shared a statistic earlier. Ohio only serves 5.9% of its 0 to 3 population in early intervention. Why do you think this is, and how can more children gain access to these services?
This is really there are many factors that I think are impacting this. And I just listed a few. I'm sure that they can go on and on, but and I believe as a state, we're continuing to improve in identifying various conditions that can lead to developmental delay. And this is shown with, our recent addition of lead exposure and neonatal abstinence syndrome to our automatic qualifiers for early intervention. And there's, it's important for us to recognize that there's new developments all the time, and we need to stay on top of these and understand and remember that there's always going to be room for improvement no matter what, and no matter how far we get. With the viable age for premature infants, it's now actually dipped down to 22 weeks gestation, and this is huge. There's an increased potential for complications, as we all know, for developmental delay. And while many of these might be recognized and diagnosed immediately, there's also those that may not, and they may go undetected as a result. Families may not always know what to look for. Pediatricians, that we're doing the questionnaires, but there's a lot of that depends on the reports of those who are around us who are around the children. And this one is specifically, it hits me just as a teacher for children with visual impairments. Outside of retinopathy of prematurity, there's currently no universal infant vision screening. And this is a big deal. We have a very high frequency of children with sensory impairments, including vision loss, those who are deaf and hard of hearing, and those who are deaf blind. And sometimes these are not detected right away. And, it's something that if we hit those up right away, then we are having much better outcomes. So with this, we really, I think, need more information regarding the benefits of early detection and intervention. And that needs to just be more readily available. We need to adjust, I think, some of the follow-up questions that are asked. And so this kind of goes along with what Melissa was sharing about the surveillance, really teaching and coaching families at their appointments, also what those things are that they should be looking for, and then understanding those questions that are being asked. I mean, I just with vision again, in asking a physician friend, she said that they ask if the ROP check has been done for infants who are premature in terms of vision, and then that's really it until they get a little bit older. So a lot of things can go undetected. And then finally, when asking a parent her take on this, she said that she thinks that many parents don't understand how key it is to have early intervention, and also realizing exactly what is available. And I mean, our website in Ohio is beautiful. And so I think families, once they get there, they're able to recognize that and kind of dip through, but it's just getting them there. And so making sure that as a community, we are really helping to spread this message of what is available. I think that also, families are involved in often many therapies, medical appointments that might have that feeling of, okay, this is one more thing, with not
Mhm.
necessarily understanding the full breadth of what it can be and what it looks like. And we have absolutely seen an effect of COVID, especially during a time where all services were virtual. That worked great for some families, and some it was not. So really just an improvements, just dissemination of early intervention
Mhm.
resource materials, especially to new parents from the beginning, so that they recognize what this is and what to look for to get there.
Mhm.
And then also through more community outreach in and how materials are disseminated at offices, doctors' offices, libraries, daycare centers, social media. We have that ability now to just get it out there. So just really taking advantage of that. And then finally, just with professionals, I mean, we're experiencing a shortage in professionals
Mhm.
across the board, and just continuing to work in the recruitment and retention of specialists is really important.
Thank you, Jenny. And, I think it really, that relationship between a parent or a caregiver and the pediatrician, I think is so valuable. Many parents, don't have a background in early childhood education or early intervention, right? And so they're looking to a pediatrician as someone as the expert, really, right? Like, I didn't get the degree in babies or anything like that. And so having a trusted relationship with the pediatrician and having a pediatrician ask those appropriate questions, I think is really valuable. Thank you, Jenny.
Welcome.
I'd like to now introduce Erin Simmons. Erin is married and has 6 children. The 2 oldest are gifted, and the next 2 have dyslexia, and her boys both have autism, with one being severe and nonverbal. Her boys both participated in early intervention, and through EI, she learned how to connect with her children and how to be an advocate for them. With the confidence she gained during her time in EI, she has gone on to participate in the Family and Children First Council, the state leadership team, which is an advisory committee in a national cohort, and the Governor's Early Childhood Advisory Council, where she is the co-chair. Erin is the president of the Seneca County Board of Developmental Disabilities. She is currently a parent mentor and works with 7 school districts to help parents and schools work on issues with the IEP process. None of this would have been possible without learning the importance of parent participation through EI. Her developmental specialist made her a better mom. She changed her family's life. Erin is passionate about teaching other parents the impact they have when they engage and participate with their children. Participating in EI has been the greatest parenting decision she has ever made. Thank you for being here, Erin, and you are very busy, so we appreciate it. So can you just talk about your experience, becoming involved in EI? And with the services that your kids received, and then if you had any advice to give families regarding how and whether to utilize these services.
My journey started out, my son at almost 2 years old was screened with the MCHAT and realized, yes, he was on the severe end. And we went through the process of getting a developmental specialist, and we referred to EI. We started EI right away, and my service coordinator came in, and we came up with the IFSP, and we discussed what the importance was, what do I want with my son? And I wanted to communicate. My son was nonverbal. I had no way to communicate with him. So we set up a plan to figure out, how am I going to learn to communicate with my son? And so each week she would come in, we did play project. And she would come in and she would teach me how to play with my son, how to connect, how to engage. And then I would work on that from week to week, and she would help me understand how to communicate with a child who's nonverbal. She gave me tips and suggestions each week. There were times where it was stressful and I just was making it to the next visit. Like, if I can just get till Karen gets here, she was really a lifeline when I was struggling to parent my child, and he was my 5th, first one diagnosed with a disability. It was really hard. It was really hard to emotionally and cognitively understand what is going on. I didn't understand. So she was there. She explained what autism was, what to look for, and what was typical of those behaviors. While every child is different, there are some of those standard things to expect with our children. And so I learned a lot from having Karen come into my home and teach me how to connect. And to me, that was the biggest part, was getting that information every week, having that encouragement, someone there saying, you know what, you can do this, you are doing this, you are doing great. And really validating that I was improving. My son was improving, you know. She showed us little things, small victories, and how to enjoy those small victories. We had a speech therapist coming in for a while for my second son. So we would have our developmental specialist and the speech therapist come in. And that was great. She came in and we worked on sign language with my son, and he started picking that up. We didn't need any OT or PT with ours. I know some different EI has different services they offer, but definitely the speech was a huge thing for my son. And it really did help my youngest son. And I become a better mom because she taught me how to slow down and read their nonverbal cues, read their behaviors are telling me something. And it was my job to figure out, what are they telling me without words? And how can I give them words or signs or gestures so that they can communicate in a way that maybe isn't typical, that most families would do, but we learned how. And that was incredible, because for the first time in 3 years, I was actually connecting with my son. And to me, all of the work was well worth it to be able to figure these things out. And they're skills that I use to this day. My son is 9.5. And those skills that she taught me, those tools that I learned, are still very valuable today. You know, it lays that groundwork of a mentality of putting the child's needs and putting their development first, and looking at every little step in progress, not focusing on what our child can't do, but what can they do, and then work from those skills of what can they do, and celebrate. She taught me how to celebrate the little things. Everything is a victory, and that's great. You know, we don't focus on the negative. So yes, definitely having all those services available is incredible.
Thank you so much. So what advice might you give families, regarding how to utilize their service or whether to utilize these services?
I am very passionate about telling parents, trust your gut. If you think something's going on, tell your provider. And if for some reason your provider is not listening, tell them again. And tell them again until you get the support you need. Get that referral. You know, it's you can refer yourself if you're not getting somewhere with your provider, or maybe you haven't spoken to your provider, but you still have concerns. Someone will come out and they'll say, yes, you know what? We see some delays. Let's get some help. And it's proven, the earlier you get those supports for a child, the earlier you start working on those skills, the better off they are long term. And so I'm very passionate about learn early. Get it done early. If you see signs, as soon as you see them, get in contact with your physician or refer yourself to early intervention, because maybe you won't need early intervention right now, but if your child continues to show signs, maybe in a few months, they might qualify. It's well worth the effort for your child to get the development that they really need. And it's a lifelong impact. Early intervention definitely has changed not only my boy's life, but my life also.
Thank you, Erin. And your kids are so lucky that you're their mom. As the co-chair of the Governor's Early Childhood Advisory Council, can you describe the role of parents in advising DODD and implementing Ohio's EI program?
Yes, so on the advisory council, we sit on the council, we listen to all of the department heads, including DODD, and we explain, what is it like to live with a child with a disability? What are the supports that we need? What are the supports that are working? What are the supports that are not working? And we really help shape that real look at, what is a family going through? What are they needing? How can we support them? And so it's really just about telling our story, telling what it's like EI programs are wonderful. Some are struggling, some need challenges. So it's really good to hear every side. How can we improve it? How can we improve it for not only families, but for the people who are providing the services, because like it was pointed out earlier, we are having a shortage in people. So if we can reach everyone and make it a better program, not only for the families and the children, but for those who are educating our children, that's really what I'm there for.
Thank you, Erin. I'd like to now introduce Terry Betts. Terry Betts is a servant and results-driven leader with over 20 years of management and operational experience working within the social service and educational field. Key areas of experience gained include early intervention, business development, contract management, and building community relationships and networks. Currently, Terry serves as senior manager with United Way of Greater Cincinnati, Success by Six, with a mission to advance early care and education in partnerships with parents, partners, and schools to ensure all children ages 0 to 6 are healthy and ready to succeed by the time they start kindergarten. Thank you for joining us, Terry. So the impacts of early intervention are well documented in research. Why do you think EI is so successful?
Well, thank you, Amy, for having me as well. It starts with that first phone call, whether a parent, caregiver, or it could be even a family member. I know Erin mentioned that too. It could be anyone assisting a parent or caregiver. And I use those two because, we do have caregivers who are also caring for children. But that first phone call with early intervention, just going through that call for parents, caregivers to go through the process of telling their story. It's difficult, whether you are a parent with a child that's recently discharged from the NICU and just have all sorts of things going through your head. Learning of a recent diagnosis, just the health and safety of my child. What does this look like? I know from experience being the division director for both the central coordination site in Hamilton County, as well as overseeing the service coordination piece. But that first initial, what we call our referral process, it goes through a battery of, I would say, person-centered questions. And those individuals who are answering the phones, and even if it's a walk-in, they're very sensitive to the nature of what the situation may be, because everyone's situation is different. So that first initial call, and then the knock at the door when a person is receiving the services and supports. The service coordination teams, whatever county you're in, there's not enough I can say about that workforce. They are very centered around the ecosystem of families, and all families are different. All home environments are different. All cultural backgrounds are different. And so they do take the time, I will say, take the time to kind of look at that with all the information they have in advance. But they are there for the parent caregiver to, let's just breathe for a minute. Let's just take a breath. And you'd be surprised over the years when I was in the direct management of that, just the stories where a first visit could be that crying shoulder, or that shoulder just to hold their hand and say, you know what, hope is a word that we use in the IFSP plan. That's the individual service plan, where that hope is for any parent. What is the dream going to be for my child as a young child? We want to always encourage preschool. And what that preschool placement or preschool school will look like for that individual student. Those impacts in terms of, like I said, it's the first knock will set the precedent for families, and they will want the service coordination team to come back. And then we bring in the interdisciplinary team with the speech therapists, occupational therapists, all of those transdisciplinary individuals who are there. And I will say, I'm going to use the word vibe. The vibe of that system is something that it cannot be captured. If we could capture that anecdotal piece of it from a data perspective, and they could be doing that, whether they start taking videos with parent permission, but that is where the first nucleus of the impact starts. Because then parents, caregivers are in a position where they can really kind of focus and think about all the medical diagnosis, all the upcoming evaluations. What does this look like? But service coordination, they are the key, as well as the other disciplines involved in terms of why this is successful. We have the data, they're tracking the data and certain data systems as far as the completion rates and then where children score. So we have all that. But I would say the biggest impact is to get the families in, have families, caregivers be comfortable. No, my house is not clean today. I'm having a day that's one of those days, but I
Yes.
still need to have those services for my child. And what's so interesting is unique to watch how they also bring in the other children who may not be involved in the service, but they're still there as a united family so that their siblings can help kind of encourage that. Also, it's a learning for the entire family. So when you talk about that first knock at the door, that first full visit, it is really a family-centric environment so that everyone can learn, what does this look like? Where can I go? And that whole IFSP, I would always call it, that's their dream, that's their hope. And they can see the progression as they go along when they do the updates. You know, I started here and now I'm here. And wow, now my children we are actually registering for preschool. and those supports that are going to be there. And it teaches also the parent caregiver how to speak their voice. What is their voice? I don't understand this.
Thank you, Terry. Yeah, our speech therapist, when my daughter was in speech, when you're with your child every day, you're like, maybe she's not saying as many words. And then you have someone come in and say, oh my goodness, from our last visit, look how well she's doing now. And then you're like, actually, you're right. I think she was. Thank you. What impact have you seen early intervention services have on families in your area?
That whole transition is so, if I could pack it up in a bottle and give it to others who are not engaged with transition or EI services. Again, I'm going back to service coordination. They are the whole foundation. That transition to preschool, they have it wrapped up in a bottle to the point where they have all their documentation, paperwork to help navigate families through that system, because some families are very afraid. How am I going to be looked at? What is my child going to be judged? What all those dynamics that come around, and particularly when you're in a room, whether you're doing your transition meeting at your home or at the potential school, that can be quite intimidating. And so you have folks sitting around the room. And so one of the things we would always say is we are teaching and empowering those parents to know how to manage and navigate that. And so in that packet, they have everything. It is almost like it is a framework, I should say, for preschool teachers to have everything. They leave nothing unturned. And so the impact of that data, the impact of showing the progression, the achievement and other goals that they want to work on, I would say is the bedrock, is the foundation for future teachers in their classroom. Also, the transition with supportive services that we intermingle, I will say, for their home visitation programs. There are children that come up, maybe not at the time of birth, maybe 2 months later, where there are concerns and things that are of a nature that parents and or caregivers want to tap into. That interconnection, that seamless system, we have that throughout Ohio, where the number to call early intervention to get the referral process started. I've seen transitions where families are not able to do it, and the service coordinator says, you know what, I got it. Let me make the phone call. And even though I'm in the home visitation program, I'm still able to be with you during that visit if you give me permission, obviously, so that I can help support and communicate. So there's no one that EI, early intervention, is, like they say, the earlier, the better. The earlier that you're connecting. And it's also a coaching for parents on how to navigate, particularly for children who have some standing diagnoses and things that will take ongoing. So how do I do this? I want to be the empowerment for my own child. I want to be that voice. And so we're also coaching and teaching those families how to be that voice.
Thank you, Terry. And thank you to all our panelists. I would now like to open up to any Q&A from the audience. If there are any questions for our panelists, please utilize the Q&A function and I will share it with the appropriate panelist. Okay. All right. So there is a quote here. Thank you for this, and thank you so much for not talking about Help Me Grow and using early intervention in all the presentations. As an EI supervisor, contract manager, I'm always working to educate physicians and other referral sources on the difference between the two and helping them understand a referral to Help Me Grow is not a referral to EI. I value and support the Help Me Grow programs as well, but we really need to work on referral sources to understand the difference. Thank you for your note. Here, there is a question for any of our panelists. EI service coordinator is severely underfunded. What can be done to ensure funding is adequate to provide the quality service children and families deserve? Most early intervention service coordinators are making comparatively low wages and have federal compliance, high caseloads, and huge responsibility.
I can address, I can
Thank you,
address
Terry.
that. I think part of that, and I'm glad whoever brought that question up, the unfundedness, that is, that work for, that is also an area of advocacy. And so I did jot that down. As it says by 6, we do convene around, I always just say around things that need improvement. And so we do around the workforce of our service coordination. Around that. And what does that look like? What does it take? We're dealing within the workforce around childcare. Of course, that's one title of many, but at the same time, service coordination is also around that. I know just looking at some data around the Biden administration and some of the new things that are coming that they talked about in December. Okay, so it's December, it's now May. How are we going to really kind of convene ourselves together to kind of talk about that? But I will tell you from United Way Success by 6, which we also tap into other surrounding areas, that is on the agenda as well to look at that. And I think we just need to keep advocating for for ourselves in terms of what this looks like, particularly around specialized services.
Thank you, Terry. Anyone else on the panel? And and I'll add too, Groundwork Ohio too that's a priority of ours, is advocating for these services and especially these critical care occupations that Terry, as you mentioned, early child child care workers, as well as these service coordinators in these occupations, and advocating for additional funds. Did you want to add anything, Melissa? Okay. Great. There is another question. This one is specifically for Melissa, but anyone on the call can speak to this question. This attendee says, I'm a nurse in graduate school and a pediatric nurse practitioner professor. A professor recently told me that pediatric providers are mandated to refer to EI within a certain time period. It would be great if that were true, but she can't find anywhere in the literature or online, and this has not been her experience in her practice. I think she might be thinking of a specific population, like children with high lead levels. Can Melissa or anyone on the call speak to this?
So I always say I play a pediatrician in meetings, but I am not one myself. But I'll try to explain it as best as I know. I do not know of any rule that requires like a certain time frame on early intervention referrals. I do know, there are things like lead screening is required for Medicaid patients and things like that. That's required at the first and the second your well child appointments. So some of those things are in place as regulations and laws, but I don't know there's any timeline around early intervention. And I think it also gets tricky because you have the Medicaid population and you have the sort of private payer population, but all children are eligible for certain services. So sometimes families go a private route to receive services faster. Sometimes I actually hear that those services are slower. So sometimes it's just family preference and choice too. So I do not know of anything that requires them to do it in a certain amount of time outside of, there's lots of requirements in Medicaid about what's to be provided in a well child visit. And it includes things like developmental screening.
Thank you. There's a note for you, Melissa. Thank you, Melissa and AAP, for increasing evidence-based screening and referral to early intervention. I have seen a significant improvement over the past 20 years of working in EI.
Oh, that's great.
So here's another question. The number of kids being served in EI is increasing every month. In Ohio, there was an increase of over 1,800 children from calendar year 2021 through calendar year 2022. There was not an increase in funding recommended in the biennium budget. This is critical. And I guess just wondering, if there's anything that we can say, our panelists can say to a policymaker, or if there's one thing before we leave out this webinar, if there is a policymaker on, what is one thing that you can say to a policymaker to, increase investments in EI services?
I always think it's helpful when parents come to these advisory meetings so that we can tell the policymakers and the people who are passing budgets how important and how impactful these programs are to families. And it's great that more families are reaching out and we're getting more children, but I agree that the budget needs to reflect the increase of the family's needs.
Thank you, Erin. And I think a lot of it too is information sharing. And if anyone would like to give proponent testimony to House Bill 7, there are additional dates. As I mentioned earlier, House Bill 7, the Strong Foundation Act, includes some provisions on early intervention services. And so there are some opportunities to advocate for additional funds. But I think a lot of it is just information sharing. A lot of our legislators may not be familiar with EI services in general. And so kind of starting from the bottom of, this is what EI is, early intervention works, and this is why we need to fund these services. Before we end, are there any last questions for our panelists? All right. Well, thank you to all the advocates, partners, and policymakers on the webinar today. We're hopeful that this conversation gives you some things to think about. As Groundwork Ohio's Center for Early Learning and Center for Maternal Young Child Health continues the conversation of healthy development for young children, we invite you to join us as a partner and ally. For more information on Groundwork Ohio or the Center for Early Learning and Center for Maternal and Young Child Health, please visit our website. Thank you for joining us. Thank you to our panelists for this conversation. Have a wonderful afternoon.